Welcome back, everybody, for another deep dive. This time we're diving deep into biomarkers. You know those tiny little clues that can tell us so much about what's going on inside the body?
Yeah.
Well, we've got this super interesting article from Genie, and it's going to take us through all the latest advancements. I'm pretty excited to get into it.
Me too. It's amazing how much this field has changed, just in the last couple of years.
Right.
We've gone from using just a few protein markers to finding them at the genomic level,
Wow.
the transcriptomic level,
Uh-huh.
and even the epigenetic level.
I know, it's crazy. It's like we have this whole new set of lenses to look at our health with. But there's something in the article that really caught my eye.
Oh, yeah.
Have you heard much about exosomes as biomarkers?
Oh, yeah, exosomes. That's a really exciting area of research.
Yeah, they sound pretty wild.
Yeah, they're these tiny little vesicles that cells release. And they're basically packed with information about what's going on inside the cell. Proteins, DNA, RNA, all kinds of stuff.
So they're like little messengers. Exactly.
Yeah.
And what's even cooler is that they can travel all throughout the body, carrying those messages to other cells.
Wow. So the article says we might be able to use them to detect diseases like cancer even earlier than we can now.
Yeah, that's the hope. Researchers are finding that exosomes from tumor cells often have unique biomarkers that can signal the presence of cancer even before you could see it on like a scan or anything.
That's amazing. So we're talking about like super early detection. I mean, think about how much that could change treatment outcomes if we could catch cancer at that stage.
Oh yeah, absolutely. It could be a total game changer. And it's not just for cancer either.
Really?
Researchers are looking at exosomes as biomarkers for all sorts of things like heart disease, neurodegenerative diseases, I mean, you name it.
So it sounds like exosomes could be a really important part of personalized medicine in the future.
Oh, for sure.
Yeah.
But like with any new technology, there are always going to be challenges. Like we need to figure out how to standardize the way we isolate and analyze them. And of course, we need to do lots more research to make sure they're actually clinically useful.
Right, we don't want to get ahead of ourselves,
Yeah.
but it's definitely exciting to see the potential there. Okay, so we've got this whole toolbox of biomarkers now, from those traditional protein markers to these cutting-edge exosomes.
Yeah,
Can you walk us through some of the ways these biomarkers are actually being used in different areas of medicine?
sure. Let's start with oncology. Biomarkers are having a huge impact in oncology, especially when it comes to helping doctors decide how to treat cancer patients.
Yeah, I was reading about that, how they're being used to predict whether someone will respond to certain targeted therapies. It
Hmm.
seems like we're finally getting to the point where we can actually tailor treatments to the individual.
Exactly. It's all about moving away from that one-size-fits-all approach. Like one great example is how biomarkers are being used to predict who will respond well to immunotherapy.
Oh, yeah, immunotherapy. That's where they use the body's own immune system to fight the cancer, right?
Right.
I've heard it can be amazing, but it doesn't seem to work for everyone.
Yeah, that's the tricky part with immunotherapy. It can be super effective for some people, but others don't respond that well.
So how do biomarkers help with that?
Well, they can help doctors figure out which patients are the most likely to benefit from it. That way they can avoid giving it to people who probably won't respond and spare them from the side effects and the cost.
I see. So it's all about making sure the right patients get the right treatment at the right time.
Exactly. And this is just one example of how biomarkers are changing the way we treat cancer. They're also helping us detect cancer earlier, monitor how it's progressing, and even predict if it's likely to come back.
Wow, that's incredible. It really does sound like biomarkers are revolutionizing cancer care.
Oh, definitely. And it's not just oncology either.
So oncology is one area where biomarkers are making a big difference, but I'm curious about other fields. Are there any other areas where they're really changing the game?
Oh, yeah, definitely. Cardiology is another big one.
Mhm.
We were talking about troponin before, but there's another biomarker that's really making waves in cardiology.
Oh.
It's called NT-proBNP.
NT-proBNP, I've heard that one, but I'm not really sure what it is.
Okay, so basically when the heart muscle is under stress, like it is in heart failure, it releases this peptide into the bloodstream.
Oh, okay.
And the more stressed the heart is, the higher the level of NT-proBNP is going to be.
Oh, I see.
The really interesting thing is that it can actually help doctors diagnose heart failure even before the person starts having any symptoms.
Wow. So it's like an early warning system for heart problems.
Exactly, and it gets even better.
Oh, yeah.
The level of NT-proBNP can also help guide treatment decisions. Like, studies have shown that when patients with high levels of NT-proBNP get the right medications and make lifestyle changes, they have much better outcomes.
Oh, wow. So it's not just about diagnosis. It's about helping doctors come up with the best treatment plan for each individual patient.
Yep, that's the power of personalized medicine. And biomarkers are a huge part of making that happen. And it's not just about treating diseases that people already have either.
Oh,
Biomarkers are also opening up all sorts of possibilities in preventive medicine.
now you're speaking my language. I'm all about prevention. Catching things early is always the best approach.
Right. So imagine a future where you could get a simple blood test,
Uh-huh.
and it would analyze a whole bunch of different biomarkers.
Okay.
And then it would give you a personalized risk assessment for a whole range of diseases years before you ever even develop any symptoms.
Whoa, hold on. Is that really possible? That sounds like something out of a science fiction movie.
I know it sounds futuristic, but it's closer than you might think.
Really?
Researchers are already identifying biomarkers that are linked to an increased risk for all kinds of diseases, from diabetes to Alzheimer's.
Wow.
The challenge now is figuring out how to take those discoveries and turn them into accurate and reliable tests that doctors can use in their practice.
That makes sense. So it sounds like there's still a lot of work to do, but the possibilities are pretty mind-blowing.
Yeah.
I mean, if we could identify our risk factors for these diseases early enough, we could make lifestyle changes or even take medications to prevent them from ever developing rights.
Exactly. That's the ultimate goal, to empower people to take charge of their health and make informed decisions based on their own unique biomarker profile. It's about shifting from a reactive approach to healthcare to a proactive one.
That's a shift I can definitely get behind. But with all this talk about personalized medicine and how amazing biomarkers are, I have to wonder, are there any downsides? Like, could this information be misused in some way?
That's a really important point. Like any powerful tool, biomarkers can be misused. That's why it's so crucial to have ethical guidelines in place to make sure that people's privacy is protected and that the information is used responsibly.
Yeah, I was thinking about things like genetic discrimination, where people are denied jobs or health insurance because of their genes. That would be awful.
It's definitely a valid concern and something we need to be very careful about. As biomarker testing becomes more common, we need to have open and honest conversations about the ethical implications and make sure we have safeguards in place to prevent discrimination and protect people's rights.
Okay, that's good to hear. It's reassuring to know that people are thinking about these issues. But on a more practical level, what about access to these tests? I mean, is this something that everyone can get?
That's another challenge we need to address. Right now, access to biomarker testing isn't equal for everyone. It can depend on things like where you live, what kind of health insurance you have, and even the specific test you need.
So some people have easier access to these potentially life-changing tools than others.
Yeah, unfortunately, that's the reality right now. We need to advocate for policies that make sure everyone has equal access to biomarker testing so that everybody can benefit from these advances, regardless of their income or background.
Absolutely. I love that message. It's a good reminder that scientific progress should go hand in hand with social justice so that everyone benefits.
Couldn't agree more. And it's not just about access either. We also need to make sure that doctors and other healthcare providers are trained to interpret and communicate biomarker results to their patients in a way that they can understand.
Yeah, that's a good point. It's one thing to have the technology, but it's equally important to have healthcare professionals who know what the results mean and how to use them to guide treatment.
Exactly. Education and communication are essential to make sure that biomarker testing is used effectively and ethically.
This has been such an eye-opening conversation. We've covered a lot of ground here, from the science behind biomarkers to how they're being used in real life, and even the ethical considerations. But I'm still left wondering what the future holds for biomarkers. What are some of the most exciting developments on the horizon?
Oh, there's so much exciting research going on right now. But I think one of those promising areas is the development of non-invasive biomarkers.
Non-invasive, what does that mean?
Imagine being able to monitor your health in real time using wearable sensors, or even just by analyzing your breath or your sweat.
Wow, that sounds incredible. Tell me more.
Well, we're already starting to see that with things like continuous glucose monitors for people with diabetes.
Oh, yeah?
Those little sensors that go under the skin and measure glucose levels all the time,
Great.
so people don't have to keep pricking their fingers.
That's amazing. It seems like the possibilities for this kind of non-invasive monitoring are endless. What other areas could it really change things up in?
Well, mental health is another area where non-invasive biomarkers could really make a difference.
Oh, wow.
Like imagine being able to spot the early signs of depression or anxiety just by analyzing someone's voice or facial expressions.
Seriously, that would be incredible, like having a mood ring, but way more accurate.
Exactly.
Do you think we'll ever see a day where this kind of technology is built into our phones or smartwatches?
You know, it might not be that far off. Researchers are already developing algorithms that can analyze voice recordings and pick up on those really subtle changes in speech patterns.
Hmm.
They could indicate a mood disorder. And there's a lot of interest in using wearable sensors to track things like heart rate variability and sleep patterns,
Okay.
which can also tell us a lot about someone's mental well-being.
It's amazing to think that technology could help us understand both our physical and mental health better.
Yeah, it's really blurring those lines, isn't it?
It is. It feels like we're moving towards a more holistic approach to health and well-being.
Absolutely. And biomarkers are a big part of that shift. They're helping us connect what we can see on the outside with what's happening at the molecular level. And that gives us a much deeper understanding of how our genes, our environment, and our lifestyle all interact.
So, with all these advances in biomarker testing, where do you see the field going in the next, 5 to 10 years? What are the biggest hurdles and the biggest opportunities?
One of the biggest challenges is going to be figuring out how to deal with all the data that we're generating from these tests.
Oh, yeah, I can
Yeah.
imagine.
I mean, we're talking about massive amounts of data. So we need to develop better tools and algorithms that can help us analyze and interpret all of it effectively.
So, it's not just about collecting the data, it's about understanding what it all means.
Exactly. We need to turn all that data into insights that can actually improve patient care. And that's where artificial intelligence is going to play a huge role.
AI.
Yeah, I think about
Yeah.
AI systems
Mm.
that could take your biomarker profile,
Okay.
compare it to millions of other profiles, and then come up with personalized recommendations for you, like what you can do to prevent certain diseases, how to diagnose them earlier, and the best way to treat them.
Well, that sounds like a completely new era of healthcare powered by data and AI. What are you most excited about when you think about the future of biomarkers?
You know what really gets me excited is the potential to move away from this reactive model of healthcare where we're always waiting for something to go wrong
Right.
and move towards a more proactive, preventive approach. Imagine being able to use biomarkers to identify people who are at risk for certain diseases years in advance.
Huh?
And then we could do something to actually lower their risk before they ever get sick.
That would be amazing.
Hmm.
It's about giving people the power to shape their own health destiny.
Exactly. And I think biomarkers are the key to making that happen.
Well, this has been an incredible deep dive. We've learned so much about biomarkers, from the science behind them to how they're being used today and how they might even change the future of healthcare. It's really given me a lot to think about, and I hope our listeners feel the same way.
Me too. The future of healthcare is bright, and biomarkers are lighting the way.
So to everyone listening out there, the next time you hear the word biomarker, remember it's more than just a science-y term. It's a clue, a signal, a window into what's going on inside your body. And it has the power to unlock a healthier, more personalized future for all of us. Thanks for joining us on this deep dive.